Hi, everyone. Thank you so much for joining us today. My name is Melissa, and I am a community engagement specialist here at Lehigh Valley Health Network. And I will be serving as the moderator for today's Board of Associates meeting. We are so excited for today's meeting because we have members from all of our program locations joining us for today's program. And as you can see, we are still operating in a virtual manner considering the recent pandemic activity, but also to allow easier access for everyone joining us from across the region. So welcome to all of you. I appreciate all of you continuing to engage with this program and acting as ambassadors for the Health Network in all of the communities that you are in during this time. We're going to get started in a couple of minutes. I'd like to provide you just with an overview of our format and some tech tips to participate in today's meeting. Right now, just as a reminder, we all have been muted to assure that we can hear and experience a clean program without any distractions. And we do have several speakers today, so you can review the agenda on our screen. Based on the questions that we have received so far, we're going to ask our presenters to give their remarks, and then we will facilitate a Q&A at the end. I have some pre-submitted questions that we'll address first, and then we may be able to take some live questions at the end of the program if time allows. You can submit a question by using the chat function in this meeting platform. It looks like a little speech bubble on the bottom of your screen. For those of you who are joining us from a computer, you can, as always, turn your video on if you'd like, and you can do that by clicking the icon that looks like a video camera also on the bottom of your screen. And just to note that we are recording today's program, which will be posted on our Board of Associates website in the coming weeks. I will now turn it over to our president, Sybil Stershik, for her remarks and the welcome of our guests.
Thank you so much, Melissa, and welcome to all of you. Good afternoon. I'm thrilled to be here with you today and to be with all the members and guests from all the regions throughout the network, including prospective members from our newest region, Carbon County. We do have several guests today that I'm happy to acknowledge. Please welcome with me Beth Major, who's invited by our Hazleton Board of Associates member, Jen Moisey, Aaron White, invited by Lehigh Valley member Ann Durst. I'm happy to acknowledge my own guests that I've invited today, Susan Gallius and Jim Harper. And from Carbon County, our hopefully newest Board of Associates location, we have guests and prospective members, Sharon Alexander, Jennifer Everett, Kathy Henderson, Suzanne Howland, Marcia McAllis, Joseph Pila, John Rashevsky, and Thomas Schmidt. Again, welcome all of you. We're glad to have you with us and hope you'll consider joining the Board of Associates as members with a shared interest in the healthcare of our communities. Now, unfortunately, on a very sad note, it's with a very heavy heart that I share the recent passing last month of our dear friend, our former Board of Associates president and longtime member, Jean Tillman. Jean's volunteer work with Lehigh Valley Hospital started early when she was inspired by her mother, who was a gray lady at what is now the network's 17th Street campus in Allentown. And for those of you unfamiliar with the term gray lady, what I have learned was that it was a Red Cross volunteer aide in medical services. Jean was a longtime volunteer at Sacred Heart Hospital and then later Lehigh Valley's 17th Street Hospital, where Jean served respectively as president of each of their respective auxiliaries. She also worked every Friday night at the hospital gift shop for nearly 30 years. And what's amazing about Jean was she was working full time while still being a professional volunteer. Jean was co-president of the auxiliary when Sacred Heart and she was co-president of the auxiliary when Sacred Heart and 17th Street hospitals merged, and her leadership resulted in her serving on several key positions at the state level on Pennsylvania's Association of Healthcare Auxiliaries. In addition, she was an extremely active member in AARP and other efforts too numerous to mention here. Just know that she focused her efforts on advocating for healthcare and for the elderly. Now, I do want to take a moment now to share some comments from Board of Associates, colleagues, and friends who describe Jean as energetic, dedicated, passionate, amazing, and inspiring. One tribute said, quote, Jean was one of the most dedicated people I've ever met, supporting the goal of our healthcare system in its endeavor of quality care for the whole community. End note. End quote. People also describe Jean as a true leader and a force of nature, as reflected in this tribute, quote, you didn't mess with Jean on those things that were for the common good, but you could mess with her when it came to a good joke. We're all richer for having known her, end quote. We are extremely grateful to Jean Tillman for her support of our healthcare system, and we will miss her amazing spirit. On behalf of the Executive Committee of the Board of Associates, we extend our heartfelt condolences to Jean Tillman's family and friends. And with that, I'll turn it back to Melissa. Thank you.
Thank you, Sybil. Those are some really kind words to remember such a powerful member of this group. We're going to now start our formal program with Dr. Brian Nestor. If you don't know it already, Dr. Nestor is the President and Chief Executive Officer here at Lehigh Valley Health Network, and he will be providing you all with some exciting network updates. Dr. Nestor?
Okay, I wasn't sure if Melissa was completely in charge of my audio or not. Thank you, Melissa. And some wonderful comments. Jean, I just, those are some of the most accurate comments I've ever heard about somebody that I've ever heard in any kind of recognition for someone that we've lost. Energetic, of course, but committed. I think that when you look up committed in the dictionary, you should see Jean's picture. And by the way, there is no better picture than the picture you had up there of Jean with that darn big smile and her enthusiasm. She is truly going to be missed here. She was a special, special person. Never afraid to give her opinion. Okay. Sent me emails, sent me notes, and wanted to make sure that I was remembering certain things. And I think she didn't do that just for me. She did that to anyone she cared about. And very special, special person. May her memory be eternal, as we say in our religion. So anyway, I'll jump right in here with my comments. So welcome everybody. It's nice to see we have almost 50 people online. Okay, well, in the days of COVID, I cannot even wait to get back in person, and I think we will have that opportunity soon. In fact, later today, we will be seeking unanimous approval of a new comprehensive masking strategy for our organization that will take us through stages of readiness to get back to normal, if you will. Currently, that would be red, yellow. I'm sorry, we'll start with the good news. The green, okay, would be good to go, okay, with masks fully optional in many clinical settings. We are not there yet, gang. So, and in the office setting, masks would be optional. We're in the yellow phase right now. And again, this will probably be booked later today at a CEO council meeting where we will discuss this with all of our my direct reports, but we're anxious to get that ratified and that there will be advice for whether or not we move into different stages all the way to red, where we would be back into the mess that we've experienced several times before. Hopefully those days are all behind us. But today, I would tell you that I'm very excited because at least in our office-based environment here that is not patient-facing, we will probably have masks optional in our office settings. So just to give you a relative idea of where we're headed. And I'll speak a little bit more about what our current conditions are in a moment. So anyway, welcome. For nearly 2 years, LVHN has been dedicated to creating better days ahead. You've heard us use that tagline many times. And it is the commitment to excellence exhibited by our extraordinary colleagues and individuals like you who support LVHN that we're starting to see those better days emerge now. Excellence is what sets us apart from everyone else, and it is why it is one of our core values here at LVHN. Excellent care always matters, and you'll hear me comment on that a little bit later. And we achieve that first through our colleagues. So what's most important with regard to colleagues? It's all about recruitment, frankly, and retention. As you can only imagine, our staff is beat up and beat down. This has been an exhausting period. Recently, I had some air travel where I had to wear my mask, an N95 mask for a long flight. And I would tell you, it's just, I always thought about all my colleagues back in the ER or on the floors who are wearing that N95 for 12-hour shifts. It's exhausting to just sit on an airplane with an N95 for a few hours. They've gone through a lot. They've seen a lot of death. They've seen a lot of terrible situations. And a lot of our colleagues are hanging it up, especially the frontline nurses that have just they've gotten to the end and said, I can't do this anymore. And that's hard. I mean, our nurses are the foundation of our entire organization, and we're witnessing them leave at a record pace. And it's hard to backfill. It's hard to bring new folks into this industry. So recruitment really important. Nothing matters or improves our work experience for those colleagues that are still here than having trusted colleagues on whom they can rely, working shoulder to shoulder. So we're taking aggressive action to address staffing challenges and recruit new colleagues to our team. We participated in more than 80 recruitment events just in 2022 alone, and recently hosted our spring graduate nursing conference, which drew another 40 plus participants. We intend to hire, by the way, by June, 160 new graduate nurses in one big bolus. So we are making headway in terms of bringing on new nurses. The challenge, though, is to bring on experienced nurses. So the results of our efforts, since July 1st, we've hired more than 3,000 new colleagues and supported 2,200 internal transfers. We are on track to welcome more than 4,000 new to the network colleagues this fiscal year. And this represents exponential growth, where in FY21, we only recruited 3,300 colleagues. So our recruitment efforts are blossoming, there's no doubt, but it's hard to keep up with the attrition. Nurses remain our focus, that's for sure, in our recruitment efforts. And so far this year, we have recruited more than 500 new to network nurses. Excellent care. We can change the slide, please. It takes excellent colleagues to provide excellent care. Throughout the pandemic, our colleagues have done just that, and we are finally getting some relief. As you can see, we have fewer than 50 COVID patients in our hospitals. That's remarkable. By the way, that is bumping up a little bit in recent days, but not significantly. LVHN has, since March of 2020, taken care of 16,500 COVID inpatient cases, and that is by far the most in the region. LVHN has also been the leader in vaccination. We have delivered nearly 600,000 vaccination doses, and I believe we just went over that mark. And we are the only health system in Pennsylvania that has administered that much vaccine, except for UPMC in Pittsburgh. But just remember, UPMC has 49 hospitals. So only UPMC has delivered, and they're about 5 times our size, has delivered more vaccine than LVHN. We're very proud of that. And that includes all the Philadelphia hospitals as well. The declining number of COVID hospitalizations and cases is evidence, we believe, that better days that you've been working hard and our colleagues are working hard for are now here. However, we must continue to take the appropriate precautions to protect those who are most vulnerable. We're working hard to do that. And again, as we all know, the pandemic is not over, yet there are reasons to have hope. And here are a couple. Oral antiviral medications that help reduce the virus spread throughout the body are becoming more readily available. And believe me, we will be on the front end of that. We have continued our monoclonal antibody treatment programs at full capacity to make as many COVID-19 treatments as possible and available to our community as possible when they are appropriate to administer. And we will continue to stress the importance of vaccination and booster shots for our community. All of these factors have translate into fewer hospitalized patients, and we believe that will be the case over the coming months. Excellent vision. So next slide, please. Even as we're battling the worst of COVID-19, we were still looking ahead to ensure that our health network could grow and thrive. LVHN remains strong because we entered the pandemic as a strong organization. I often say, if you were weak as a health system or hospital going into COVID, you're done now. There's no way for you to survive. The economic cost, the financial cost, the cost that we've all endured with our colleagues, especially our front-end clinical colleagues, has been dramatic. I can only feel terrible for our colleagues to the south at Tower Health, who are going through all of some of their worst financial challenges in their entire history during one of the worst, clinical periods we've ever seen, or at least I've ever seen in my career. These are challenging times. But LVHN remains strong, and as a result, for years, we've been focused on healthcare value and providing the highest quality care at the lowest possible cost. And you've heard me talk about that repeatedly at our Board of Associate meetings. And that focus on value has really served us very well. LVHN's strength, therefore, allowed us to do the following: to give our community convenient access to high quality care. And this is a list of different investments we had planned to make before COVID struck, and we held to all of them. We stopped not one single capital project. And that's evidenced by things like opening LVH Hecktown Oaks, our first new hospital in nearly 50 years. We just recently introduced the Lehigh Valley Orthopedic Institute, combining LVPG orthopedics with coordinated health orthopedics 2 years after our merger. We did all that straight through. As far as we know, by the way, we are the only organization in the country to have rolled out Epic in the middle of a pandemic virtually. Normally that has hundreds of colleagues at the elbow with our providers, and we did all that at the elbow support virtually. We're very proud of that. It was a very successful launch. We will soon open 2 new hospitals, LVH Carbon near Lehighton and LVH Dixon City in Scranton. And we recently opened up the health center at Pennsburg. And by the way, we just broke ground at a new cancer center at LVH Hazleton. All of these have been on the books for years, and finally coming out of the ground, we are thrilled. So we stuck to our strategy, and we were financially strong enough to continue to do that. Excellent experience. We can move to the next slide, please. We're embarking on an exciting new journey here. So it's not all about bricks and mortar, that's for sure. It's not all about excellence. It's not in clinical care, not all just about recruiting. It's also about, and probably most fundamentally, an excellent experience for our patients, and to have it reliably. As you know, we've struggled with some of this at times, especially on the inpatient side, over the last 10, 15 years. And we really have been improving those environments, both in terms of refreshing those environments, but also in terms of how we're delivering care. So now we are embarking on a new program, which we refer to as the Experience Lab. Over the past year, a group of senior leaders from across the health network have partnered with the Experience Lab, a healthcare experience design company, to help explore new possibilities for how we deliver the right type of experience for our patients. And they've created a framework for how we will build the culture and experience we've always imagined. And throughout the first half of this fiscal year, calendar year of 2022, select colleagues will come together for a single-day immersive experience called Partners in Caring. Remember, we want to be our community's partner. It's not about us. It's about our community. It's about our patients. And how can we be the best partner to them? Partners in Caring, really for us, is the essence of delivering the right kind of experience for our patients. And all of these gatherings of leaders across our organization will be a way to exchange ideas and help create the experience that we really want to deliver to our patients at LVHN. So we're very excited about that. And by the way, a cohort of about 100 of us will be spending about a day and a half tomorrow and Friday just on this framework and try to help refine this so we can cascade it across our entire organization. Next slide, please. Excellent care always matters. We recently conducted some research that we want to share with you, and the research was conducted by asking people in our community what they value the most in their healthcare provider at LVHN, and what they think of LVHN, and what they identify as our greatest strengths. The key learning from this research is that LVHN is clearly the region's leader in delivering high quality healthcare. We rank significantly higher than our competition in every single metric. And here is what our community says sets LVHN apart. It's the quality of our doctors, nurses, and clinicians. It's the quality of the medical services we provide. It's our ability to treat critical and life-threatening conditions. It's our commitment to providing leading edge care and treatments, and it's our promise to serve the community. Well, now we always thought these things, but it's certainly nice to get validated by the people we actually serve. Now, how do we make sure that this is delivered in a highly reliable way, in an experience that resonates with our colleagues and our communities? And that's really our focus now. Now that we have the ship very strong financially, we have a fabulous strategic plan that we continue to execute upon. Now it's really getting down to the brass tacks of how can we really make sure that our every single patient we touch feels as though they're at the right place with a partner looking out for them. In the eyes of our community, LVHN owns high quality care, and we are very proud of that. Our depth of experience in specialized care in particular puts us in a leadership position, and that is our ownable differentiating quality. We want to inform our colleagues about the results of this research as well, not just our good friends with the Board of Associates. And we want to celebrate and get our entire LVHN family even more excited about the high quality care for which we are known. We'll use the Experience Lab to do that, and we'll cascade that over the next couple of years across the entire organization. But we also want to tout our reputation and leadership in the community by sharing stories of excellent patient outcomes. So in the coming months, we will introduce a new communications theme that speaks to what we are about and what sets us apart from everybody else. And the theme is excellent care always matters. And by sharing stories about our excellence, and many of them are patient stories and colleague stories, we will energize our colleagues and our entire colleague base and make you even more #LVHN proud to be part of the LVHN family. We will move toward our goal of capturing people who are not loyal to a specific health system and have them become loyal with LVHN. And you can only do that by delivering an extraordinary experience, an excellent experience. We also will move toward our desired state of helping people realize that LVHN is the only place I should turn for my care and for the care of my family and for all our healthcare needs. If we can do that, then I think we've proven we're the right kind of organization for you to support and be part of. Those are the end of my comments. After a long time away from all of you, it's wonderful to see some faces here. It's wonderful. You all look well. That's great to see. We're really excited about this journey. I often, as an ER doc, I get criticized by my colleagues, which I am very comfortable with, that I am often too hard. I can be too negative. But that's what comes out of being a worrying ER doc for 25 years. I think the worst all the time, every day, because if I do, I can often prevent that from happening. But I would tell you, I am the most optimistic guy around here now, which is really a strange position to be in, because I can truly see that we have weathered a fastball thrown at our head from left field in this pandemic. We have weathered it. We have demonstrated we can provide the most care, the best care, the most vaccination, and be there for our community in a ways that I felt was unimaginable for any organization. And we did it, and we're proud of it. And I think when we went into this in the first week of COVID, when the governor shut us down, I met with a few of our leaders and said, you know what? At the end of this, I want to be able to say to the community that LVHN was the COVID leader in every way. And I can tell you today that we were, and we will be, and we're proud of it. And I think it served as an accelerant for us to provide the best possible experience to our communities. LVHN is strong and will remain strong. So happy to take any questions you might have. Melissa, you're back in the boss seat.
Thank you. Thank you again for some of those updates. Super helpful to hear from you. And before we open it to any questions from the group today, we did receive a pre-submitted question from one of our members. They wrote, people in the community are asking about the new hospital in Macungie on the site of the old Weiss Market. What is its purpose? And equally important, why the continued expansion when healthcare staff are in short supply?
Yeah, well, it's let's go to staffing. You ended with staffing. That's our problem. That shouldn't be the community's problem. Okay, the community wants and needs more access to care, more convenient, high quality access to care that is more affordable. Okay, so keep that in mind. The staffing thing, big problem. We're going to just have to figure it out. By the way, just to give you some news, we are financially strong, but that's not without incredible work. This year, this fiscal year, so last July 1st through this June 30th, LVHN will have absorbed $150 million of a negative variance in temporary labor and incentive costs just to bring in temporary nurses and other staff just to cover the hospitals. Now, what does that equate to? Equates to, close to 500 traveling nurses, all right, and other staff. Our entire operating margin for this company at 3.5% operating margin, which is what we budgeted, is about 125 million. So we will absorb somehow more than our operating margin in this year, and that's only because of unbelievable diligence in operations and finance and our physician groups to be able to somehow try and make that up, but also spend whatever is necessary to make sure we're adequately staffed. I'm very proud of what we were able to accomplish there. So staffing is our problem. Okay, I just wanted to give you a little nugget on how much we've had to commit to make certain we had adequate staffing. And by the way, we are tripling, quadrupling our recruitment efforts. All right, as I mentioned, we're bringing in one of the largest new graduate nurse cohorts we've ever brought in, 160 for this summer. And we are on track to double, triple, and quadruple our efforts at multiple schools across the state and nation for recruiting new nurses and also experienced nurses. So we'll handle that piece. But what I mentioned in that preamble is we need higher quality care at a lower cost that's more readily available and easily accessible. Because the closer we've learned that in the value-based world post the Affordable Care Act, that patients value having easy access to care. Sometimes that's a virtual visit over the phone. Most times that's just being able to be seen easily and to get access. The closer the care is to where you live, the more likely you're going to access that care. And if you access that care, the more likely you're going to be engaged in your care. Okay, I will fill that prescription for insulin. I will check my blood sugar more often. I have a doctor I can readily get into. I have an express care location that is right down the street. I have a health center that's right in my community. I don't ever want to go to the hospital. My God, keep me away from the hospital. But here what we've developed is what we refer to as micro hospitals or neighborhood hospitals. And here's a good example. If you think about how we're trying to care for all those hundreds of thousands of people in Northampton County that are part of the LVHN family. By the way, before we ever had Hecktown Oaks there, we had close to 500,000 Lehigh Valley Physician Group visits a year, 500,000 at our 4 health centers over there and some of our practice locations. So when we decided we needed hospital inpatient assets over there, because if you live in, let's say, Nazareth or Easton, you weren't going to, if you could avoid it, you wouldn't get on 22 to go to Muhlenberg. If you could avoid it, you wouldn't get on 78 to go over to Cedar Crest. All right. We built a brand new hospital campus over there that in its first phase was 25 ER beds and 30 hospital beds. That's not a big box like you might see down the street at the St. Luke's Anderson campus, which is a very typical, beautiful building. They're a good quality organization, really provide good care. There's no doubt about it. But what we don't need in our community are hundreds and hundreds and hundreds of new big box hospitals. What we believe, if you can have a woman come in and get a hysterectomy okay, through Da Vinci robot at 11 a.m. and be discharged home at 3 p.m., never having to be in the hospital. Less pain, no incision, a couple of portholes, and less risk for infection and bleeding. Why would you need a hospital bed for those patients in the future? If you can do a radical prostatectomy through a single port Da Vinci robot, which we do, okay, we're probably only one of a dozen that do these, but through a single port Da Vinci robot across the globe, by the way, all right, in the initial rollout of this, where you can come in and at 7 a.m. have your radical prostatectomy performed through a Da Vinci robot single port, where you go home with a single hole and a couple tiny portholes, all right, at 7 o'clock at night. 10 years ago, you'd be admitted to the hospital for 5 days. You'd have a Foley catheter for nearly 2 weeks. You'd be out of work for close to a month. We have people that are going home the same day, catheter out in 5 days, back at work in 7 days. How many beds do you need if that's the kind of care that you're providing? Not as many, right? So we have a vision for providing really high intensity, high technology, even procedural and operative services in an environment that gets you home very quickly. When you start to calculate the number of beds you need to do that, it's not hundreds, it's sometimes dozens. So now we call Hecktown Oaks a full service general acute hospital. And we have had a recent addition of another 30 beds because we've had so many people want to use the services there that we didn't have enough beds. So we undershot the runway. So we'll be up to operationally about 45 to 60 beds. We want to titrate the investment only to what the community needs. All right, not overspend. This is not where we want to spend money. We want to spend money on getting people really great access to care and getting them home and keeping them at home because their outcomes will be better. So at that place this spring, we'll be actually opening an ICU. And we'll probably be expanding services incrementally over time. That's a general acute care hospital. We still think that that's a big hospital, okay? If you go up to Carbon County, you're going to see a hospital up there that we call a neighborhood hospital. That's only 10 ER beds. Okay, I'm sorry, 15 ER beds and about 20 hospital beds. We're open in Dixon City with roughly 15 ER beds and 25 hospital beds. We call these neighborhood hospitals, sized appropriately for the neighborhood, convenient access so people will immediately go get that care. Now, Macungie, finally going to answer your question, Melissa. Okay, Macungie. That is what we would refer to as a micro hospital, which is consistent with the Pennsylvania state new regulations around these unique hospitals. Initially, they called them innovative hospitals. Now they're referring to them as a micro hospital. That is 10 ER beds, 1 behavioral health emergency bed, and 10 hospital beds. These are relatively small facilities. They are not that as expensive as a hospital to set up. They have 24-hour emergency services. They are fully state and federally qualified hospitals. And it is the right size for that community and that demographic. We serve a lot of patients there, and we want to make it more convenient for them to be able to access care without having to get on the roads, get on the highway, and go to Cedar Crest, for example. All right. How can we make that easier? So this will not be the last one of these. I think you're going to wind up seeing more of these in the market. And this is all consistent with our approach to producing value, higher quality care at a lower cost. So the cost of operating these will be lower. It'll be easier accessible, same high level quality of care. Generally, the people that come to those hospitals will have short hospitalizations, 1 to 2 days. And if they need more than that, we can always take it to a higher level of care. But we think that these will be very welcomed by the community. It will be their neighborhood hospital. So that's why we're doing it. I hope that addressed the staffing related issue. The investment, I think, this is a new way of caring for our communities going forward. We shouldn't be building 100-bed, 200-bed, 300-bed hospitals anymore. We have those already. We have great market centralized locations of 200 beds up in Hazleton and out in Pocono. About 100 beds, 150 beds out in Schuylkill. We have a Muhlenberg that's several hundred beds. We have Cedar Crest, a quaternary tertiary facility with hundreds of beds. We are in that marketplace. That's probably enough, but we will be adding to this, if you will, ambulatory environment with these smaller hospitals. Happy to take any other questions.
Great. Thank you so much, Dr. Nestor. In the interest of time, don't want to keep you longer than I need to, but thank you so much for joining us today. And you are welcome to join us for the remainder of the program if you'd like. Otherwise, again, thank you so much for joining us today, Dr. Nestor.
Thanks, gang, and thank you for all your support. You have been loyal to us throughout this entire COVID pandemic. You stayed in touch with us. You gave us encouragement. Many of you volunteered. You dropped off goodies, many of you. We just are so thankful to have you as part of the LVHN family, truly. And by the way, you've started a crusade across the region. We have Board of Associates now up in Pocono. We have Board of Associates out in our other markets as well, and you've been a model for that, and we're grateful for your partnership. Thank you.
Thank you, Dr. Nestor. It is now my pleasure to introduce to you Terrence Purcell. Terry is the president of Lehigh Valley Health Network's Northwest region. He is also the current president of Lehigh Valley Hospital Hazleton and our new campus, Lehigh Valley Hospital Carbon. We're grateful that he has joined us today to share a little bit about himself and the growth of the network in the northern regions. Terry?
Thanks, Melissa, and good afternoon, everybody. It's great to be here. It's an honor. I'm also very happy to see all of our Carbon associates that'll be joining us and being part of our new Carbon Hospital. So it's great to be here. So I was asked to describe a little bit about my background and a little bit what we're doing in our 3 new hospitals. So first of all, my name is Terry Purcell. My career started in Hazleton. My first job, there used to be 2 hospitals in Hazleton, a Catholic hospital and a state hospital. And I worked for the Catholic hospital, and my office was actually in the convent. So it was myself and 5 nuns. I was 22 years old, and luckily I went to Catholic school growing up, so I knew how to get along with the nuns. After 2 years, I moved to another position. I went to Good Samaritan, which is now LVH Schuylkill. And I had the opportunity, I worked there for 6 years. I worked in HR. I also did some physician recruitment, some strategic planning. I had the opportunity to work with Bill Reppy at that time. So Bill and I worked together for 4 years. We became friends after that. And I was there for about 6 years. And then I spent the next 25 years in Carbon County. I worked in human resources. I eventually moved up through operations. I became the senior vice president of operations. And our hospital at that time went through a merger proposal, and the decision was they decided to join St. Luke's. I was a little surprised by that because LVH was such a good partner to the Blue Mountain Health System. LVH provided telemedicine services to Blue Mountain. It was the first hospital in the state of Pennsylvania to get telemedicine outside of the network. So the decision was made. I became the president of the St. Luke's Carbon campus. And after a couple of months, I realized it just wasn't the right organization for me. I decided, I made a call to my friend Ed Doherty. And after a couple of days, I decided to join Lehigh Valley. And it was the best phone call I ever made. And I'm just so happy to be part of the Lehigh Valley network. I started out as a vice president of market development in the Carbon, Schuylkill, and Hazleton markets. I became the president of Carbon when we announced that opening of that campus. And a couple months ago, I was named the president of the Northwest region, which is the Hazleton campus, the Schuylkill campus, and our soon to be open Carbon campus. Next slide, please. So in Hazleton, when I followed John Fletcher, they were very big shoes to follow. He did an outstanding job leading healthcare in the Hazleton market. I tell him he's a legend in the local Hazleton healthcare market. But from a hospital standpoint, the hospital, very successful hospital. We've been full the whole time. We've been growing. We've been expanding. I think one of the most important things about Hazleton is Hazleton was the first COVID crisis town in Pennsylvania, in addition to Stroudsburg. But the hospital worked together with our local legislators, with business, with the community to make sure that we could stem the tide of COVID. At the same time, the hospital grew. We doubled the size of our emergency department. We're renovating all of our ORs. And so the hospital's on a continued growth path. And my goal is to continue that path. as Dr. Nestor mentioned, our new cancer center at Hazleton, we just broke ground on $20 million cancer center. We're going to be doubling the size of our infusion bays, and we're also going to be introducing LVHN radiation therapy at our cancer center. And also what's outstanding is there's room for growth. So it's a 3-story building, and we'll also have one room will be used for future growth. So we'll be introducing a lot of additional providers to the market. So we're very excited about that. In the middle, we have our Health and Wellness Center at Hazleton. It's actually Dr. Nestor, I heard him describe this as the nicest health and wellness center that we have in the entire network. So we're very proud of that at Hazleton. So we have plans that we'd like to grow the services that are available locally. We're working on our strategic plan, and we're looking for some expansion in that area. On our lower right, we have our Desson Center. We have a combination of our internal medicine and our OB practices. And, you know, when you look at all the physicians and providers in these practices, they're all at 110, 120% capacity. So we need space. So we had a call this morning just to review the plan for the Desson Center. We also have a health center up in Mountaintop. That's in the lower left. Today I found out that we're offering a physician that will be, if you need a transplant, our physicians can see you in Mountaintop, just to try to eliminate the need for patients to travel down to the Allentown campus. And what's missing on this slide is our coordinated health station circle station circle building. This was part of our coordinated health merger. One of the things we did not have in Hazleton prior to that merger, we did not have orthopedic surgeons. So with this merger, this brought 6 additional orthopedic surgeons to the market. And in addition, we have a orthopedic surgeon that left, and that's coming back because of this merger. So Dr. Tony Valbello spent several years in the Hazleton market. He's a native. It's a very well-known name. So we have new physicians that are coming to Hazleton. And at our Station Circle building, it's a great location. It's right in the industrial park. You're going to see a significant amount of industrial growth in the very near future. And this building is located perfectly. The building is only 40% complete. So we're looking at, should we be expanding family medicine? Should we be putting express care? What other services can we put in that building? So there's a detailed strategic plan that's going on for the Hazleton market. And hopefully as we, in the next couple of months, we'll be able to announce what some of those plans are. Next slide, please. Schuylkill. Schuylkill is a personal campus to me. This is where my family gets their care. I have a lot of family that work there, physicians and staff. Schuylkill, my children were born at Schuylkill. So it's just a very personal organization to me. I spent 6 years there. The hospital itself is doing very well. They struggled before the merger with Lehigh Valley. You know, it's been a struggle. In the last few years, we've been doing pretty good in the Schuylkill campus. We've seen significant improvements in our emergency department. For example, I'm sure you heard that there was a mass casualty accident on Interstate 81 a couple of weeks ago. There were 16 of the 24 patients were taken to hospitals, and all 16 of them came to our Schuylkill campus. So we have a reputation for outstanding care. Our physicians are second to none. Our nurses are second to none. So we're very pleased with that. Our South Jackson campus, we have 3 behavioral health units. As you heard over the COVID pandemic, there's been a significant increase in behavioral health conditions, and we're constantly holding 8, 10, 12, 14 behavioral health patients because there's nowhere for them to go. So having a strong behavioral health program is extremely important to the local market. And on the lower left, the Schuylkill Family Medicine Residency Program. The average age of a physician in the United States is 51 years old. The average age of a physician in Schuylkill County is 63. So we have a lot of long-term physicians. A lot of them work into their early 80s. So we need physicians in Schuylkill County. We need primary care physicians in Hazleton and Carbon County. And this residency program is going to help supply the physicians for the future. So we just got our first match. We matched 4 first-year residents. So every year we'll have 4 additional residents. So eventually we'll be able to supply the local community with our much needed family practitioners. Next slide, Melissa. And then lastly, our LVH Hospital in Carbon. I'm so proud of this one. This is another personal hospital to me after spending so much time in the community. Lehigh Valley has an outstanding reputation in Carbon County. At one point, we had 33% of the market share with very little assets. And that's because Lehigh Valley was very nice to the local network and did not compete with us. And when we look at our market share today, it really didn't drop much because of our outstanding reputation in the community. So we're opening a full service hospital. It'll be a 16-day ER. The ER physicians will be the same physicians that staff Cedar Crest. So if you can imagine that, the same physician that will see you at our level 1 trauma center will see you in our hospital at Carbon. So talk about quality of care. And no other hospital could boast that type of quality of care. We'll have full radiology services from CAT scan. Our MRI is being put in right now, full cardiology services, full inpatient and outpatient surgery. Also with the coordinated health merger, there were 9 physicians in Carbon County that were practicing without a hospital. So now they were seeing a lot of local patients. So we'll be able to take care of those patients locally and they will not have to travel. We'll have a 20-bed med-surg unit. You can see that's the 2nd floor. And you'll hear hospitals are putting in healing gardens in their hospitals. But when you look out from our med-surg floor, the entire Mahoning Valley is a healing garden. You can see for 4 or 5 miles at a time. And it's just such a beautiful view. So we think that'll be very therapeutic for the family. In addition, we have a health center attached to this hospital. On the ground floor will be our outpatient services. We'll be reintroducing our Topper Cancer Institute Infusion Center. We'll be having a pharmacy. We'll be combining outpatient rehab services. We'll be opening a cardiac rehab program. And then the 2nd floor will have space for about 23 physicians at a time. So the one thing Carbon County doesn't have is access to physicians. We rank 61 out of 67 counties for access to physicians. So Lehigh Valley will be bringing those physicians to the market and eliminating the need for the patients to have to travel. So I'm excited about this. Our plan is that we're going to open June 8th. We can't put that date in writing because the Department of Health wants to make sure that they give us the final blessing before we open. So that is our target date. There's a lot of excitement in the community. For those that live in the community, you know that. I met with a doctor this week and they told me there's a lot of patients that are not scheduling their diagnostic exams because they want to come to Lehigh Valley when they open. I had the ambulance company tell me, you would not believe how many people they go to put in the ambulance and the patients say, I can't wait till Lehigh Valley opens. So there's a lot of excitement, a lot of enthusiasm for the community, and we can't wait to open. And I'll answer Melissa's question just about recruitment. So we've been very successful so far recruiting. I just reviewed the stats this morning. We have 900 employees that work at Lehigh Valley Health Network that travel to one of our other campuses. So a lot of those people transferred so they could work close to home. In addition, I went through the list and there are many new faces that we've added that we've recruited from other health networks. Because we have a great reputation, we've been recognized for being a great place to work nationally and locally. So we have an outstanding reputation of being a great employer. Dr. Nestor is a fantastic leader. The leadership team that he's assembled is second to none. And I couldn't be prouder to say I'm a colleague at LVHN. And with that, I'm open to any questions. Sorry to go so fast. I'm trying to keep everyone on schedule.
Okay, you're getting a raise, Terry, for that last comment. Well
All right.
done.
Thank you.
No, we are truly fortunate to have Terry on our team. Actually, I don't think Terry was ever not on our team. He was a tremendous partner for a long time up at Blue Mountain, and was a great participant at our nightlights for so many years. So it was really a friend calling our network, and we're just thrilled to have him with us. So welcome, Terry, in this new role, which now is an old role for you. You've been working pretty hard for a few years now. So thanks for your remarks.
Thank you.
Thank you so much, Terry. And in the interest of time, I'm going to save questions until the end. So at this time, it is now my pleasure to introduce to you Stephen Zinowitz. Stephen is the Senior Vice President of Lehigh Valley Health Network, and he is also the new President of Lehigh Valley Hospital Cedar Crest. We're also grateful for him to be joining us today to share a little bit about himself and his new role at the network. Stephen?
Great. Thank you. Thank you, Melissa, and thank you, Terry and Dr. Brian Nestor, for setting up such an amazing pathway for me to end today's presentation. And my comments are only additive, so it's an honor, and I'm very excited to be part of our health network here at Lehigh Valley. As mentioned, I'm the president here at Cedar Crest. I've been in healthcare for over 25 years. My wife, Linda, and I originally from Long Island, New York. I graduated from St. John's University and went on to Columbia for my master's degree in public health, health administration at Columbia School of Public Health. And I've also been a long-time board member of the American Heart Association, and I look forward to becoming active in the local American Heart Association here in Pennsylvania. Prior to joining the Lehigh Valley Health Network, I was president and chief executive officer at St. Barnabas Medical Center in Livingston, New Jersey, a large teaching hospital and also the flagship of the RWJ Barnabas Health System. And prior to Livingston, New Jersey, I was we were out in Seattle, Washington, and I was the CEO at the University of Washington Medical Center, an academic medical center with research. If we could go to the first slide, please. Oh, and was before mentioned about our staffing, just this past Friday, myself, my nurse executive, and several others went over and visited Cedar Crest College, met the president there, as well as the director, the dean of the School of Nursing, so that we could build a stronger liaison with them. And there's actually projects that we're already launching as a result to help them with the training and teaching of student nurses, as well as giving Cedar Crest College student nurses more of an opportunity to be part of training at our campus. Our Cedar Crest location is a large campus. From this view, you can see that we have several different buildings. It is the hub for our institutes, our Cancer Institute, Heart and Vascular, Surgical Excellence, as well as the Orthopedic Institute recently launched, as well as our Neurosurgical Institute. Also on this campus is Lehigh Valley Riley Children's Hospital. Our colleague there, president is Ann Baum, and they do an amazing job and have a separate pediatric emergency room location for our peds patients. And we have a newly expanded over the past 2 years emergency department, the largest emergency department in the state of Pennsylvania. We are also a level 1 trauma center, so we take care of the most critically ill patients that come to us. We are also a level 4 center for our neonatal intensive care unit, which offers the most advanced care and technology for our youngest patients, our micronates. We also have the regional burn center at our Cedar Crest location, and we are magnet recognized for nursing excellence, and organizations, hospitals, and medical centers that are magnet recognized are also organizations where it is proven that we have some of the highest quality and safest care. A couple of new things that are occurring as we speak is with the affiliation with Memorial Sloan Kettering Cancer Center, we have access to clinical research trials, which really differentiates us in the region, that we're able to offer patients and their families technology that others can't at this time. and so that it is curative for them. Very shortly, working with Memorial Sloan Kettering, we will be able to offer CAR T-cell therapy, which is a type of therapy for different types of cancer, lymphomas, or leukemias. And it uses it's a cell-based immunity cell therapy cancer, and it's proven to be quite successful. Also, recently, there is the use of augmented reality for 3D visualization of anatomy and procedural guidance that we currently use in our neurosurgery procedures, cardiology, and urology. Dr. Nestor mentioned about robotic surgery. We have a fairly advanced robotic surgery, probably the best in the state, if not the region. The robotic surgery for patients that will benefit from that. One thing that I know that will be of interest to the group is we have a Voice of the Patient Advisory Council, and we welcome input from our communities that we serve. And if any of the Board of Associates would like to participate in that, it gives us an opportunity to share with the community what we're doing and to receive your input and feedback on our services and how we can improve your experiences. If you can go to the next slide, please. We also have a location at our 17th Street Hospital. We have a variety of community clinics there. Can you go back one? It's located in southwestern Allentown, and we have a breast health services, including advanced technologies for the digital mammograms, as well as the diagnosis of for patients that have that come to us for breast health services. We have a sleep disorder center at that location, memory center, many comprehensive health services, and a transitional skilled unit, which helps as patients are ready to transition to a different level of care and don't need to be at a tertiary quaternary center such as our Cedar Crest location. They can be appropriately taken care of and transition to our skill unit at 17th Street. And our 17th Street Hospital is also recognized as a magnet organization. Okay, last slide, please. We have, on the last slide, we have a orthopedic specialty location, our Tilghman Center, and we have 4 operating rooms, and we have some advanced robotic technology to assist with our hip and knee replacements. And it is a center for our orthopedic medicine initiatives. We also have an express care location there for patients that don't need the rigors of an emergency room. And it's a beautiful location, well run, and located not too far from our main hospital here in Cedar Crest. My number one passion is safety as our number one priority. And as an organization, we are on a journey of high reliability, and all of our colleagues and employees have a mindfulness of safety and look for opportunities to strengthen our processes and systems so that we have the best possible outcomes for our patients and their families. I wanted to be thoughtful. It's just 1 o'clock, and Melissa, I'll turn it back to you if there are any questions. And as I settle in, I look forward that I am invited back to give more of a robust overview of all of our great services that we have.
Before you take it, Melissa, I just wanted to say again, this is Stephen's first introduction, if you will, to the Board of Associates. So we are very, very fortunate to have attracted Steve and his talents. He has extensive experience in tertiary quaternary services and has an unbelievable track record in that regard. So we're grateful to have Steve with us. It's both Steve and Terry are in a fabulous lineup of presidents over our inpatient campuses, and the work that goes on in our hospitals is tougher now than it's ever been. So these are huge roles, and we really rely on them, and we're fortunate to have their talent. So Steve, welcome as well.
Thank you all so much. I really appreciate all of you joining us today. I know we had a really busy meeting agenda, so I appreciate you all taking the time to join us today. In the interest of time, because we are past the allotted time, I'm going to ask if anybody has any questions for any of our presenters. Please feel free to email me those questions and I can get them to the appropriate person and make sure that we get you the answers that you need. Again, thank you so much to Dr. Nestor, Terry, Steve for joining us today. It was so great to hear from all three of you. There are some really incredible things going on here at the network, and I don't know about everybody else, but I feel really proud to be a part of that growth. So with that, that concludes our formal program today. I want to thank you again to our presenters and to each of you as members for joining us today, including all of you from all of our other regions. We will continue to keep you informed of the latest updates, and of course, we want you to continue to stay healthy and safe through this time. Please have a great rest of your afternoon, and we will see you next time.